Hello, David.
Hello, Yassine. Thank you again for putting effort into these very informative, I hope, videos. This one is about how to look after the eye and what to expect from cataract operation, and it's aimed for patients primarily.
Fine. We'll just jump straight to it. I guess the first question is, what can patients expect following a cataract surgery?
So even after uneventful cataract operation, patient usually will experience on the day one a bit of a blurry vision, and there are two reasons for it. One is pupil will stay dilated for up to 48 hours after surgery, and the second one, we always will create a little bit of a swelling in the cornea, which is the clear structure in the front, and as it gets swollen it becomes a bit hazy and blurs the vision. So I would expect for patients after the operation to find out that the eye may be a little bit red, vision may be a little bit blurry, and it should start improving within a week, I think, in most patients. There's also a normal sensation of discomfort because we create scratches on the surface, and there may be little cuts on the thin skin of the eye for the injection. And again, this should heal primarily within 48 hours, where the surface will settle and the pain will resolve. Patients are encouraged to take some painkillers if they experience that, okay? And there's also some level of discharge, which would be normal. The eye may be watery after the operation. And again, I think within the first week, these things should generally settle by and large.
The corneal edema, should that clear up within 4 to 6 weeks?
When we looked into patients' questionnaire, most patients are pretty much independent after the first week. And it's very individual thing. So it may be cleared the first day, but most settle within a week. Sometimes it takes a bit longer. And there are some patients who are at risk of the cornea being swollen for longer, and I'm sure they will be told that before the operation, especially if they have some corneal abnormality, some corneal disease, which can make it prone to swelling, but also if the cataract is very dense and hard to remove. So these things generally take within a week, but may take a bit longer as well.
And how would a patient look after their eyes after the surgery?
So first thing to do, it'll be all explained in day surgery before they discharged. First thing to do is to take the dressing off. And the dressing may be either clear shield for topical anesthetic or full dressing with a patch with a subtenon. So they can take this off the next day and clean the eye. There will be clear instructions on the discharge letter as well how to do that. So you can use cool boiled water with clean cotton buds if there's any sticky discharge around the eye. Gently take it away, open the eye, and do the first drop. Okay, so the first thing is do the drop as prescribed. The course is usually, again, in most patients for 4 weeks, and it will be explained how, and you'll be given instructions how to use it with a table to fill in. First week, the drops goes in 4 times a day, then 3 times a day for the second week, twice daily for the third, and once daily for the last. So the whole course normally is 4 weeks time. That's the first thing. You can keep the eye clean, as I said. Some degree of discharge is normal, and again, on the instructions, sorry, probably we can just stop. So yeah, you can keep the eye clean as per instructions if there is a bit of a discharge, but don't go inside. Generally clean just the eyelids on the outside and maybe eyelashes. The eye will clean itself during the healing process. You can also keep active, so we don't encourage people to sit at home and do nothing. It's nice to keep active after cataract operation, and the limitations of activities are very small. So normal light housework, walks, and light exercise is to be encouraged.
And what should be avoided?
So generally, there's not much. I would say heavy strenuous exercise or hard work, which leads to sweating and maybe contaminated sweat running down into your eyes. And the other thing which links to that is also exposure to any potentially contaminated water. So we discourage swimming in the swimming pool, sea, or going into the hot tub. And I would say for at least a couple of weeks after surgery, but if you want to be safe, do it for 4 weeks. By the time everything is settled and healed.
What about those who wear contact lenses? I know they're a bit elderly, but
the contact lenses generally will not be required after the operation because the refractive side of cataract surgery will get rid of glasses for distance in most patients. And again, I would encourage not to use contact lenses until the eye is fully settled in 4 weeks' time anyway.
And what are the serious signs of a serious problem?
Again, if you remember on discharge, you were told about a few signs that will mean that there is potentially very dangerous thing happening, and that's infection. And the most vulnerable period is the first week after surgery. So if I said the eye may be a bit blurry on the day one, this is the baseline. It should gradually get better as the time progresses. But if it gets worse within the first week, so if the vision drops, or if the discomfort, which is potentially settling initially and then becomes worse, the pain increases, then it's a reason to call the number that you will be given in the discharge paperwork to get in touch with either eye casualty during working hours or out of our service with our on-call team.
Fine. So how long would it take to settle?
Again, that's individual. So you asked about the question, how long will corneal swelling resolve? Generally speaking, after 4 weeks when the drops are finished, eyes is in 99% settled and ready to see optician for updated prescription. Some people may see quite well even in the time before that. So it is very individual really, and depends on how the surgery goes and how the eye looks like before the operation as well.
And driving is another common thing when someone...
That's the common question. So it's impossible to say exactly for every individual patient. I think it's patient's responsibility to decide when they're safe to drive. Generally, if they were able to or legal for driving before the surgery, they're still legal to drive. But as I always say, the vision after surgery changes. The vision may be blurry in the eye that we operate on for at least first few days. So I would encourage a bit of caution and a bit of respect to others. Maybe if you want to be, again, very safe, you may want to be seen by optometrist and having your glasses done 4 weeks after operation when the drops are finished. But to be honest, very often people can see quite well. So as long as you can see what is necessary for being able to drive, I'm quite happy for people to carry on driving.
Similarly, going back to work?
It's similar as well, depends on the work you do. So again, if you're exposed to dirty environment, the work is heavy, and there is a risk of potential contamination of the ocular surface, I would encourage maybe at least 4 weeks, at least 2 weeks staying off work. In some lighter jobs, office-based jobs, when you can do the jobs during the working time, again, you may go back whenever you feel comfortable enough.
Fine. And finally, in summary, David, how would you summarize this?
So after the cataract surgery, do not rub the eye, use the drops as prescribed, and keep the eye generally clean on the outside. And that should lead to satisfactory healing process. Again, if you come across quite severe pain or increasing pain and loss of what was previously a reasonably good vision, you need to get in touch with the eye services as soon as possible.
Fine. Thank you very much, David.
You're welcome, and thank you for helping taking our department into the 21st century.
Thank you.